Okay, then I guess quite nicely to what I presented fits what Maddalena and her colleagues did in relation to doing a SWOT analysis. So I hand over to Maddalena.
Thank you, Sonia. Thank you so much. And it is a privilege for me to share the results of the work that we have been developing in collaboration with István Kósa and with the team from Hungarian colleagues. So in this presentation, we will provide a focus on the work developed in the application of a SWOT analysis. And basically, we are all aware that there are many mobile health solutions in the health fields, but there are still a number of elements that hinder the integration of this, the full-scale integration of this mHealth solution into health systems. And one of the issues is that the scale-up plans are not built and are not in place since the pilot phases for integration of the routine services. As Sonia referred in general, broadly speaking, about digital solutions, there are a number of places where these solutions can be integrated in the process pathways. And if we look at, if we focus on type 2 diabetes, there are a number of exploitations we can implement related to the epidemiological surveillance of type 2 diabetes that can take advantage of mobile health solution. Mobile health solution can help in collecting all data that can be used for risk stratification using artificial intelligence solutions, and also they can support the lifestyle changes that are pivotal and a key element in the treatment of diabetes, type 2 diabetes. We also can integrate, can exploit the mobile solutions to strengthen the integration of the services, of the different services that are needed for the comprehensive management of type 2 diabetes. And all this can be only achieved if mobile solutions are identified as a priority in the digital agenda. The KT2 tool, as nicely was referred in previous presentation by Sonia, is a multi-step approach to support the adoption at scale for type 2 diabetes and mHealth solution. And we started out with the country self-assessment and interview to outline the perimeter of implementation of mobile solutions focused on diabetes. And based on the information we collected in this interview, we developed this SWOT analysis. The SWOT analysis was then paralleled by the categorization of solution, the adaptation of the persona needs that flew into the KT2 algorithm, facilitating the match between the persona needs and one or more mobile solutions that could be implemented in a specific country. That in our case is applied to Hungary. The SWOT matrix that will be later on presented by István will show what are the elements that we can build on to implement a tailored approach to mobile health solution for diabetes, and what are the opportunities that can be exploited at this time by Hungary case to scale up the adoption of these mobile health solutions, and which are the threats that we need to prevent in order to allow a smooth implementation at scale of mobile health solutions. So let me hand over to our colleague, and István, if you prefer, if you just tell me when to move on the slide, okay. I will proceed.
Okay, thank you for the opportunity to take part in this presentation. We agree that I will present the individual point of the SWOT analysis because we participated hard in the generation in this SWOT analysis. So, what is one strength from, in Hungary, that we have a single purchaser financing system in the healthcare, and discovered theoretically the whole populations. This is really a beneficial factor, but we should say also that the regulation of this financing system is pretty inflexible. This is regulated by law, and it takes pretty much time to adapt these regulations. Another strength that we have a very hard e-health infrastructure called EST, which is capable to handle patients' documents from any provider. And during the last years, the personal health record was also developed in Hungary. This is, I think, a pioneering event because the general availability of personal health record, which can store the home measured data. This is not generally available in any country of the European Union. Next slide, if I can. And but what is reserves that there are several projects running within the country. One of them focus on the financing reform led by the WHO local office, and this project try to strengthen the coordination of services, what is pretty fragmented currently in the country. And the purpose is to initiate hybrid service model, including outpatient and inpatient care as well as home care services in one month. Of course, we try to involve in the analysis several players, including decision maker, GP specialists, and so was our analysis developed. Can we go further? The next one. It is critical how is the digital skill running at the level of the professionals and the citizen. I believe we are in an improving stage. It is promising the availability of internet access and mobile internet access nowadays in our country. Can we go further? And we should agree that a great weakness that our care is hardly fragmented due to the event financing present also at the level of outpatient care and inpatient care. The coordination of the care is insufficient, and this rely only on the moral hazard of the participating physicians, and there are gaps between the physicians. The current law regulates, for example, the prescription of new diabetes drug related only at the specialist level, and it is not available at the GP level. And a weakness in Hungary, and I believe in the majority of the EU countries, that the care is hardly dominated by the medicative intervention, including drugs and hospital treatment. And this is the case also in the case of dysfunction or disorder related to lifestyle abnormality like obesity or diabetes, hypertension. Next slide. And the opportunities, I think we should move toward the new innovative telemedicine solution. We should use our method electronic health record system, which integrates already nowadays the e-prescriptions, and Hungary has luckily digital health legislations and defined the national plan for chronic disease management. And it is also opportunities that the current pandemic promotes the mHealth, e-health service of the diabetic patients. And of course, any project utilizing mobile technology is threatened by the high turnover of the tools. It is clear that in Hungary we lack the buy-in from relevant stakeholders, actors, and the COVID pandemic has also another side. It delayed the service, the clinical studies, and last stress that we should really develop the financing, because the current financing system cannot cover the chronic disease management programs which rely on the home of the patients. Okay, the next slide is this is not only incentive. What is the rationality to deal with the lifestyle of the patients? This is a famous study published some years ago in the Lancet, and demonstrates how relevant is the correlation between the body weight reduction capability of the patient and remission of type 2 diabetes. It is clear if a newly diagnosed patient can change his body weight by 15 kilogram, he has a chance for 86% for remission, total remission from diabetes. And next slide. In this regard, we believe the lifestyle intervention in this population is highly relevant. But we are running in Szeged. This is training monitoring and diet monitoring. Next slide, please. And this is only an interim picture about the currently running study. It's clear that this intervention can be used in any level, at any weight of patient. You see there was several patients in the weight group between 150 and 200 kilogram, and there was pretty considerable weight reduction. Next slide show only the change of the body weight. You see a high proportion of the patient was able to reach this 15 kilogram weight reduction. Of course, there is about a quarter or third of the patient who was not responder for such mHealth intervention. Okay, and the next slide, I believe it's already belongs to Maddalena.
Yes, thank you, István. And this is just a slide to exemplify how a combined approach, where we make an effort in exploiting the strengths to address the opportunities being created now is presented. Scusa, Vincenzo. For example, we have at this moment, many countries are working on the National Resilience Plan and orienting the financial resources available towards strengthening the asset of the human resources that have been identified as a key pillar for the scale up of the mobile health solution is very important. And probably it will be important to change or create necessary rules in the regulations, and also to introduce new professional figures in the, that are equipped with the soft skills needed to support the long-term adoptions of healthy lifestyles. There is also an issue in the service fragmentation that requires strengthening of all the engagement of all stakeholders to implement the change management processes. And there is a need to map in detail the service processes to ensure that the new tools are fully integrated in the diagnostic therapeutic pathways. Also, the organizational, continuing from the diagnostic therapeutic pathways, we also need to make an effort to strengthen the organizational interventions that are underpinned by the availability of clean data and data sharing. And so we need also to address all issues that concern the availability of data across organizations at local, national, and international level. And to do so, we need to strengthen digital literacy by health professionals, and also interoperability between the different tools where the mobile solutions are integrated. There is a need, like István said, in one of the last slides, to ensure financing. So we'll have to make an effort and bundle financing in order to provide financial support to the diversity of actions that we need to implement in order for mobile solution to be adopted at scale. And this is also important to ensure that the solutions are adopted in the long term. Sorry. And so this is our last slide. So we believe that our experience, the collaborative experience, we could set up between the mobile health team and the Hungarian team is an example of a collaborative approach that can ensure the capacity building through knowledge exchange, adaptation of the solutions, and until supporting a plan for the full adoption of this mobile health, for example, focused on diabetes. So thank you for listening, and we are open for questions.